detail. It's a way of registering into this particular meeting. So I'm going to Petro, if I may check, do you want to give us some opening remarks today?
Yeah, sure. Welcome to all the colleagues. This is a nice opportunity for us to share with you the work that we've done in terms of the information center. I wonder how many of these participants that's here at the moment is here for the first time. If you can just raise your hands, because I see some names that was here previously as well. But welcome. We are going to take you through the theoretical part of how it's structured, and then there will be a demonstration afterwards. Thanks, Becky. Over to you.
Thank you, Petro. May I ask Refilwe to switch off the video link to help us to optimize our bandwidth? Okay, I'm going to share the screen. Once again, colleagues, welcome to today's training session. It's the NDoH Information Center training. We would like to give you an introduction and overview of what the Information Center is all about. So the content of this presentation is as follows. We're going to start with an overview of the Evds ecosystem, followed by more specific focus on the Information Center itself, its purpose and objectives. And then we'll proceed after that to talk about how to register in order for you to get access to the Information Center. And then we'll proceed to show you how to log in. Once you're logged in, you need to be able to know how to navigate the system. At this point, we'll have Anthony show us how we navigate the system and using the different tools that we find on the system. And then we'll talk about how do we get help in terms of making sure that we effectively utilize all the functionality that is on the system. And of course, on the live demo, we're going to cover quite a number of subtopics or in terms of the tools that we find on the system that enable us to unlock the value that is in there. And then at the end of the training session, we're going to cover the user support package. Here we share information on where you can find the document resources about this training session, and hopefully sometime soon we hope to sort of have a video recording as well of at least one training session that we've conducted, so that for people who want to refresh their memory or to remind themselves about some of the detail, they can always watch that video recording as well. So far we have, I'll talk about what we have when we get to this particular section. Now, I think in order for us to understand this much better, we have to start with the overview of the Evds. Now, the first question is, what is the Evds? The Evds is the Electronic Vaccination Data System, which aims to provide an authoritative registry to track various COVID-19 vaccination metrics towards the control of the pandemic. What are the characteristics? The characteristics are that this is an officially adopted centralized digital system. It allows us to capture all vaccination events occurring at official vaccination sites. It provides data analytics through built-in business intelligence to monitor and report. You'll find that there are quite a number of users that we find on the system. We have 4 components, and we've decided to use the color codes for participants in this training to see which users belong together At the top, the orange color code shows us the users that belong to registration and scheduling. And then next to that is the yellow color code, which represents the MFL users on the system. And then the green part is for on-site Evds. And finally, the purple part is about what we're doing today, which is the information center component. So we see that there is national user, information center national user, information center provincial user, and information center approver. Right. Now, looking at the functions and benefits of the Evds system, firstly, the function is that the system allows us to assign vaccinees with a site, date, and time slot for a vaccination, allows us to capture data, patient information, safety information, and details of vaccine sites. It records progress, reconciles payments, forecasts supply, demand, and standardizes processes. The benefits is that it ensures consent is given, it drives efficiency, quality, assesses liability, and any other risks, ensures equitable access, protects data, provides an input into other systems, such as the supply chain management and the NICD. It provides live monitoring of coverage, effectiveness, safety, and durability, streamlines budget allocations, and reduces vaccine wastage. So in summary, that is what the Evds is about. So we can proceed to talk about the components of the Evds. We have 4 components in the Evds, starting with the MFL, that is the master facility list, and then enrollment and scheduling, and then on-site Evds, and then lastly, the 4th component becomes the information center. So what happens at the MFL is that there is facility selection, facility registration, curation and permitting, approval, activation, and deactivation. In enrollment and scheduling, there is self-registration, assisted enrollment, system-generated scheduling. On-site Evds, there is verification of demographic details, capturing of health questionnaire, administering of e-consent, and the capturing of vaccinations. We can see that there are arrows which show that there is movement of data from one component to the next component. We can see that from the MFL, there is facility data which is pulled onto the information center. There is also facility data which pulls from the information center into the enrollment and scheduling, and demographics and booking information that pulls onto the information center from enrollment and scheduling. Same applies on site Evds. There is movement of data forward and backwards. So what happens with the information center is that we have data management and data governance, data quality and data analytics, data visualization and data sharing. So those are some of the processes that are happening on the 4 components of the Evds. We can see that the starting point has to be the registering facilities onto the system. The MFL captures and manages approved vaccination sites, details and permitting status, whilst the enrollment and scheduling manages vaccination enrollment through registration by self-registration using 3 different platforms or assisted registration at the vaccination site. And when those processes are, happening, the next step is that the data gets to be pulled onto the on-site Evds, which records the journey of the vaccinee who will receive a vaccine from a vaccinator registered on the Evds at an approved site on a specific date and time. So we can see that as we go along from left to right, there is some arrows to show that data is moving from one component to the next component. Overall, we can say that within the Evds ecosystem, key dependencies exist across the components. Vaccination sites must be captured and approved before enrollment and scheduling can occur. On-site Evds roles must be linked to MFL-approved vaccination sites. On-site Evds makes use of vaccine registration details from the enrollment and scheduling component. And information center is the layer that is used for data storage and reporting. Now that we've tried to give a bit of background on where we find the information center, we can now zero in on the information center itself. So what is the purpose of this information center? The information center brings together multiple COVID-19 related dashboards and data. The single sign-on platform allows and manages access to the information center itself. It currently focuses on the COVID-19 surveillance and strategic information and will over time be expanded to include other health-related themes. What are the objectives? The objective is that of providing access to validated COVID-19 surveillance and strategic information dashboards and allow export of underlying data. It simplifies access to information for operational planning and strategic decision-making in the COVID-19 vaccination program. We've already spoken about the users that we find on the system. It's important to highlight that an authorized user will have one of the two types of access, that is provincial user or national user. And that is determined in terms of how you also put across your application for access. You get to choose between the two user profiles. And when you access the information center, you'll notice that there are dashboards and it's 5 main themes that you find there. There's infections, there's a theme on infections, on hospitalizations, vaccinations, vaccination strategic information, and then vaccination management. This next slide shows us more details about each theme. In other words, there are sub-themes within a bigger theme. We can see that with vaccinations, there is dashboards that show us vaccination weeks, vaccination sites, vaccines administered, individuals vaccinated, public health workers, additional and booster doses, registration, age cohorts, and data exports. So if you go onto each theme, you'll get to see the sub themes that are available for under each theme. On the overview of the NDoH Information Center, I think it's important to highlight that the dashboards that we have on the system use different applications to use and to visualize different data sets. So we have ArcGIS, which is used to display location data. We have Power BI, which displays statistical data in table or graphical format. So the NDoH Information Center uses secure access technology to authorize users. And the lowest disaggregation of information goes up to facility level. Data is de-identified in compliance with the POPI Act. NDoH team facilitates access to provincially nominated users. So once users are nominated at province, the NDoH team ensures that they facilitate access for those provincially nominated users. Now, how do we register and log in? So once you've been nominated and you're supposed to apply for the role of accessing either provincial or national, and you want to access the information center, you will have to follow this web link, which is here below. It says login.health.gov.za. So if you open from a browser, this particular website, it will lead you to a page that shows a landing page with this image that we see on screen. So if you are going to access the information center, you start by registering. And the process of registering involves you filling out a form. So once you get to this space, you select the button that says register. As you can see, it's here, or it's here at the bottom here. It says new user, register. So if you click on the part which says register, it will take you to this page. And this page at the top, you can see that it says, if you want to read through the registration guide first before you proceed, you can click on this button, and then the registration guide will download, and then you can read the registration guide. I think it's not very long, maybe 3 or 4 pages. It's very short. It helps you with the process of filling out the registration form. Now, the registration form is what we see here below, and I'm going to take us through the different parts of this registration form. So the first part of the form is that you're going to provide your name, your surname, your national identity number, email, and mobile number. Once you've done that, you also have to provide details about your organization, right? It could be a provincial department, it could be national department, it could be an organization such as CSIR. You just have to specify the name of the organization here. Now, on this part which says province, you need to specify the extent to which your responsibilities are going to be extending. So if you are, when you specify that Gauteng, it means you will be given the role that allows you to access information in Gauteng. If your role extends to national, in other words, you're not restricted to one province in terms of what you're supposed to be, your responsibilities are supposed to cover. It means you have to scroll down to the bottom and look for the part which says national. So if you select national, it means your access to the system, you'll get to see all 9 provinces in the country. It's important to highlight this one. The next thing is that as part of registering, you need to set up your password. So you have to enter your password twice. So you enter it here and then you have to re-enter it here. And you have to remember this password because as soon as you are approved to access the system, you will have to remember this password because you'll get an email which says, here is your username and here is you are now approved, you can now access the system. So you will have to remember this password that you entered at this point when you were registering. It's possible to change it afterwards, but you have to make sure you remember it. You also need to provide details about your manager, their name and email address and telephone. You also have to specify the reason for access. After that, there are terms and conditions. And after reading through the terms and conditions, you'll see that there's a checkbox here which says I agree. So it's important that you check this box before you proceed. And then you can lastly specify the start date and the end date for the access that you're requesting. Once that has been done, you are happy, you can click on this button which says register here at the bottom. So if you click register, that information goes to the national team, and then they'll be able to review your application and to consider approving. After your user role has been approved, it's possible for you to update your profile. This page that we see here, you can only see it after you've logged in and you are inside the system. You can see that here's the menu. It says menu, home, user, themes, help, and logout. So you go to this part which says user, if you want to update your profile, that is. And then if you click on that button, it will take you to this page where you can update your password. And if you would like to update who your supervisor in the event that that particular individual has changed, or their telephone, you can also update that. So once you've done those updates, you can change. You can select this button which says change, and then it means that your new information starts to apply from that point. Right. The next thing to talk about is the issue of logging in. How do we log in? Remember, we said you have to follow that web link which says login.health.gov.za. So if you type that URL onto a web browser, it will still take you to this page that I showed you earlier on. And this time, instead of going to register, you go straight to username or password. So you can use a username because the username is provided once you are approved, or you can use your email to log in. So you put in your username or you put in your email, and then you put that password, and then you click on the button which says login. If you click on login, it takes you into the system, and then you can begin to navigate through the platform and to access the many dashboards that you find on the system. So from this point, when you're logging in, I think we're going to hand over to Anthony to take us through that part. But before Anthony takes over, I'm going to ask if there are any questions. Could be that there may be some questions, and then we can address those questions before we proceed to do the next part. I'm just trying to access the. Okay. I don't see any hands, and let me check comments. I don't see any comments as well. I'm going to ask my colleague Anthony to take over from this point and take us through the online platform, the system.
Becky, thanks very much for that. Hi, everyone. My name is Anthony Selico. I'm the project manager in the CSRR, working very closely with National Department of Health on the data science and analytics. And this particular product is one of ours. And I'm looking forward to the opportunity to take you through some of the practical aspects of navigating your way through the portal itself, as well as through the dashboards. So I'm going to do a screen share and we'll jump in with a slight overlap of what Mbeki did, starting off with the login screen, and then we'll move forward. Okay, so as mentioned, the starting point is the login.health.gov.za. When we click on that, we're taken through to what is now the familiar login screen, where you can also access registration if you haven't already registered. So we're going to work on the assumption that you've already managed to successfully register and you are now an approved user. And so I'm going to log in. I think at this point it's quite important to bring a distinction between whether you registered as a national user or provincial user. I'm logging in with credentials for a national user. So what I'm going to show you inside the dashboards is going to be information that is contained for all 9 provinces. If you were a provincial user, then the highest level of abstraction of data that you would see is your province, and then obviously down to district, sub-district, etc. So when we go in now and you see information for all the provinces, that would be your perspective as a national user. And if you're only a provincial user, you'll just see one level down from there on. So here we go. This is the landing page. This is the main portal screen. The practical, the demonstration that I'm going to give is going to have a few main aspects to it. Number 1 is going to be how to navigate this portal, the main screen, the main portal, how to access the different themes, how to go to the help section, how to go to change your credentials, etc. The subsequent section will go into an actual dashboard, and then we'll break down how to navigate in the dashboards itself. So in the beginning, at the top right, we have some main buttons. No one will see admin. This is a privilege for certain users to help administer the portal and the users. So Pietro and myself have access to this, but you won't see an admin section. The next button on the top right will be the user button, and that's where Mbeki showed us you can actually go to change your credentials. It will bring up a form that basically gets populated with your details, and you would be able to edit and change those details if necessary. The main navigation of the portal, based on it being segregated into themes, can be achieved through 3 different methods. On the top right, you can click on the drop down and you can choose one of the 5 themes. And when you click on one of the 5 themes, it will actually zoom to or take you to that particular theme. And that just means that in terms of whereabout in the portal you've moved to that section, and you have one or many links, buttons, or URLs that will connect you to actual dashboards and reports. So going back home, I might want to go to a particular theme. I'll do it through selecting the drop-down button, click on the theme, and that will take me to the infections theme, where there is one dashboard available for us to click and go into. Another way to navigate the themes is there's a carousel, a scrolling banner that's over here at the top, and you can click your way through those themes. And when you reach the one you want to navigate to, you can click on the View Theme button. That will also take you to the theme. It's exactly the same as the drop down. It's just an alternative way of navigating the portal. And the third way is if you scroll a bit further down, you have the 5 themes in sort of icon form, where you can say view theme, and it too will take you to that particular theme. So the key issue here is that you have 3 different methods of navigating to the themes. The reason is because some methods render better on mobile, some render better on a PC or laptop. There's a help section, also top right. When you click on the help section, it takes you through to a section in the portal where you can access help documentation. There's the guide to registration. There's the guide to the landing portal, which is in effect what we're doing now. Then there are guides to some of the most of the dashboards themselves. So you will see different PDFs available to you. These download buttons, when you click on them, will open up a window. It'll allow you to save a PDF to your local hard drive or network drive, and then you can open up that document, and it is basically help user manuals or even help with navigating the portal itself. Going back home, I'll take a small break point just to check if there are any questions about how to navigate through the portal, the themes, the help sections. If no questions, we'll start with navigating inside the dashboards.
I don't see any hands or comments in the chat box. I think at this point, maybe we could continue.
Okay, great. Thank you very much. So just a quick overview. So I'm going to jump into a few of the dashboards just to show you the breadth of it. And then the depth, we will go into one specific dashboard and show you how to navigate inside a dashboard itself. The first theme, infections, has a dashboard which presents information which is taken from the regularly approved and published figures on infections, on deaths, recoveries, COVID cases, etc. You'll see this on almost all of the dashboards, that there will be some information on the top, which will either give you a small amount of detail on the dashboard itself, or in some cases, this will be the first page will be an actual disclaimer page in and of itself, which will contain quite a lot of information that's very relevant to the dashboard. You'll then start to see information pertaining to that particular page. And then if there isn't a more elaborate menu system built into the dashboard, which we will see later, at the bottom of every dashboard, you should have tabs like in Excel, Microsoft Excel, to move you through the different worksheets. So you can click on the tabs at the bottom, and those tabs at the bottom will take you through to different pages in the dashboard where you'll see different information being displayed. I'm not going to go into too much more detail on this particular dashboard. It was just to give an overview of what's contained in the dashboard for this particular theme. Going back to the portal and to the second theme, hospitalizations. This dashboard, created and managed by NICD and displayed and accessed through the Department of Health portal, gives you information relating to the admissions, hospital admissions. So based predominantly on DATGov data, it shows you how many admissions you've had over time. It shows you if those are in ICU, high care, on oxygen, ventilated, etc. And it gives you breakdowns in terms of districts. Once again, at the bottom, you've got different tabs, different pages showing the information in different formats with different tables and graphs. And you can click on those tabs and it can take you through to the different pages. I will go into detail how to use filters and how to access the information within the pages in the subsequent dashboard. It's just an overview of the hospitalization dashboard. That's the second one. The third theme, vaccinations. the core of the EVDS information I will come back to, and we will delve deeper into one of the dashboards. But just to touch on the last two remaining themes, vaccination strategic information. There is a dashboard here. It contains such information such as forecast numbers and what percentage of the forecast for vaccine, the vaccine rollout has been achieved, etc. This dashboard is under review and also being updated potentially. So the information contained herein may be a bit dated. Some of the figures were forecasts from previous months. So there is a review underway to see if there is still value in the information in this dashboard and how it should best be updated. So this is a fourth theme, but as I say, the dashboard that's in here is somewhat limited. Please view it with caution in terms of what you see in here. And the last theme, vaccination management, relates to two different dashboards, which are on a fairly practical level, will give you the ability to manage such things like your paper-based back capturing records to see age analysis, etc., relating to that. It also will give you the ability to view information like summaries by hour for different facilities and different demographics. So the paper-based back capturing would look something like this. Where you can see, as I said, breakdowns for age category, for date categories, and it's showing you back captured versus live records that are entered into the system, and then there's different breakdowns of that information by province, etc., by first dose, by first and second dose. So once again, just splitting your information up and giving you different ways to visualize and work with it. And then the last one before we delve deeper into a dashboard in order to manage how to navigate within dashboards, the hourly breakdowns, taking information relating to what time of the day vaccine sites are actually most active when they're doing most of their vaccinations. You have a whole range of filters available to you at the top. I'll show you how to use them in another dashboard. And you have different breakdowns of the data. So that's really just a high-level summary or overview of the different dashboards that are in the portal. And now what we're going to do is go deep into one particular dashboard and cover topics such as how to filter, how to use data exports, how to navigate within a dashboard itself. A small breakpoint just to check, Mbeki, if there's any questions so far.
At this point, we still have no hands or questions, but may I use the time to remind colleagues that if you have a question, please place it on the chat box, and then we can attend to it. Maybe some might have forgotten. And I only noticed that there is one person that has registered for this training. Colleagues, may I ask you to follow the web link on the chat and register, because we need a record to say when we did training, there were so many participants. I kindly request you. I'm sure some of you might have attended before, but we still need you to register for today's session, except for the people that are organizers or presenting. So we expect you to still register, please, colleagues. Thank you.
Thanks, Mbeki. I was going to say now for a word from our sponsors before you gave that announcement, but come people, they're massive prizes being given away if you register. There's a lucky draw, and no, I'm only kidding, but I think it is important that everyone registers, please. We do need to keep record. Okay, so now we can go into a particular dashboard and we can explore how to navigate in the dashboard, and the majority of what we will uncover is applicable to other dashboards. Not everything and not every page, but the majority. There are multiple dashboards in this theme. Just a quick mention about what you'll see. There are 7 provincial dashboards for vaccine coverage. These are fairly geospatial dashboards, which give some practical information broken down into the different districts, sub-districts, and lower. And these are dashboards that were developed in Esri ArcGIS, as opposed to, for example, Power BI, what you'll see in 1 or 2 of the other dashboards. The platform, the portal, supports multiple technologies. The reason why there's only 7 instead of 9 dashboards here, the other 2 are work in progress, but we are trying to create a single national view for the information that's contained in these 7. And we're trying to fast track that this can be put onto the portal so that you won't have to differentiate by province through a separate link, but rather like all of the others that are there. For example, these 3, they contain all the information in one national view, obviously filtered by province if you're only a provincial user. But it's a slight change in the paradigm when all of these have been set up as 7 individual links. But as I say, stay tuned. We are hoping in the near future to move over to a single national dashboard, which will contain all of this information and will then obviously include the other 2 provinces as well. There is a site evolution dashboard. This dashboard contains information very similar to the main vaccine rollout dashboard, but it is structured in a very fundamentally different way, whereby vaccine sites and hence services are associated with a linked facility in a different manner to the vaccine sites and services that you'll see in this dashboard, in these dashboards, where the vaccine site and service is linked to a parent facility. And the differentiation between them is quite subtle. I won't go into the details now, but it is written on the disclaimer or landing page that you'll see when you do enter the so-called site evolution dashboard. And reach out to your colleagues and if you want to explore the differences between them, because it is very significant but also very subtle. There's a historical reason why it evolved from these 2 and eventually to this one. But as I say, that's going into nuances which are beyond the current scope of training. But information is available to assist you on how to differentiate between the information you see here, which will be similar but not exactly the same as what you'll see in the other dashboards. The second one here is for undocumented individuals. The information contained in here is not duplicated in this main dashboard. If you wish to have combined figures, you will use both the first and the second, and you will have to combine the values which you receive. There was a decision made, and it is mentioned once again in the important disclaimer section that undocumented individual information is not contained in the main dashboard, but it is available to you through the second dashboard. Having said all of that, a lot of preamble, I'm going to click on that main link, open up our main dashboard and start navigating within it. First off, the disclaimer page containing very useful information. Please do read it at least the first 1 or 2 times just so that you're familiar when, for example, the dashboards update, so that you will know what information you're looking at. If it excludes or includes certain specific information, like I mentioned, with regards to back capturing, etc. The next thing to look at on the top, basically, is the last updated date and time. In this case, yesterday at approximately 8:20 in the evening, which is when it was scheduled to run. It did so and completed before 9 o'clock. It's important when you do have queries on the data, if you do have queries on the data, please quote the date and time of last update, as well as the specific pages that you're referring to, so that we know how to best answer any queries. At the bottom, you have your main tabs that you can navigate through, like I've mentioned before, but there's something in addition that we have on this particular dashboard. It's a main navigation menu system, which was built to help the user to more easily navigate through the dashboard. So you can click on main menu. It brings up your first level of main menu, where we see 9 different buttons available to us, and they each contain almost sections within this particular dashboard. If we now zoom into a particular first level menu, like vaccines administered, being very distinctly different from individuals vaccinated, we click on this button, we'll come up with a second level of menu, the 2.1, 2.2, 2.3s, and now you have the pages within the vaccines administered main section 2, and you can click on a particular page. It will then take you to the page itself. Staying with the navigation menu, you'll see once you're on the page with the information, on your right-hand side, you have access to the main menu, the first level, as well as the sub-menus, the second level. So there's no need to go all the way back to the main menu and then into the first level and then into the second level. At this stage, I can change and go to any pages within section 2 simply by clicking on them at this right-hand navigation menu section. As well as I could jump to my first level, I could go back to this level 1 menu, and then go into a particular page. And now I'm on the page and I have access to everything in level 1 in section 3, or I could go back to different main levels. So this is really just the ease of navigation, in addition to just a long sequential list of tabs that you have at the bottom. Main menu, first level, second level. Just before we go on, we are going to talk about vaccination weeks. You do have a section here where it'll tell you exactly what the start and end dates are for each vaccination week, starting with the beginning of the vaccination program, the 17th of Feb 2021, and going all the way through to current. So that refers to when we talk about vaccination week numbers. Okay, that's a bit about the navigation within this particular dashboard. We're now going to look at a very important concept, that of filters. As you can see, what's on the screen in front of us is quite a plethora of information. We have different indicators, we have different charts, and on other pages, different tables that give us numerous information relating to the topic that we're looking at. But it may be that you don't wish to see summary information for all of the provinces, all of the facilities and sites, for both public and private, for all medical aids, for all vaccine types, for all ages, etc. You may want to start filtering the information and getting more specific. There are main filters that apply to almost all pages, but not all pages. And there are some filters that you will see change as you go onto a different page. A typical example, we'll come to it later, but I'll just show you, is that if I click on the age filter on these pages that we're looking at now, I have options to select between 10-year age bands that are based on population data. There are other pages which have been constructed in a way that the age filter allows you to filter the registration age cohort bands of 12 to 17 olds 18 to 34-year-olds, 35 onward, etc. And there's historical reasons behind it, but there's also logical reasons why some of the other pages will be constructed with different filters. So just be cognizant of that. There are ways to work around that. If you do want to see a different age band, there are ways to deal with that. Starting with filters, we'll start with the location information filters. And this is top left, giving us the ability to select province, district, sub-district, etc. Some of the generic ways of manipulating filters are as follows. If you click on select all or deselect all, it will do that. It will select all or deselect everything. But you may choose to only want to select one province. So you will deselect all by clicking here. Then you will move to your province, you will click and select it. So it's normal buttons where you can basically check boxes where you can basically select or deselect a menu item, a filter item. And as you select that, you'll see in real time it's changed all of the values, indicators, graphs. They are now filtered and showing only Gauteng data. What if you wanted to have multiple provinces, for example, or within a province, multiple districts? So then when you've selected Gauteng, you may want to say, I want to see that together with Western Cape. You will hold down the Control key and then left click, i.e. select Western Cape. And then it's selected both Gauteng and Western Cape. If I didn't hold down the Control key when I selected Western Cape, it would have deselected Gauteng and selected Western Cape only. So I can add by holding the Control key and clicking on additional items in any menu. The same will apply in the age cohorts, etc. And if I want to deselect one of these three, once again, the Control button will allow me to toggle. So I could deselect Western Cape and only remain with Gauteng and Northern Cape. So again, you can select and deselect all, or you could just select one, or you could hold down the Control key and select multiples. That's a general principle of how to navigate when you have drop-down menus like this and multiple choices underneath. Another way of selecting information in a filter, applicable to more than just the one we're currently on, but this is a good example. I may want to select something at a lower level than my province. As you can see quite faintly, but there are drop-down arrows or indicators to the left of the checkbox. If I click on that, it'll expand the selection, and I now have the next level of abstraction, which is district. So at this point, I can actually select only Joburg, for example, or Joburg and Tshwane. I can now go and select, just like I did with province, I can select individual districts. Or, because I still have a drop-down available to me, I can expand Joburg and say, okay, well, which of Joburg regions do I want to actually have? Maybe not all of Joburg, maybe I only want to have selected ones, and you can do the same. Or you may wish to exclude a particular district, in which case you'd hold down the Control key and select those districts, and now it's giving you all of Ekurhuleni, etc., but it's excluded Joburg regions D and E. So that's the drop-down button that's available to you. When you see it, it can expand your selection to the next level of abstraction, and you can select or deselect individual menu items there, which will filter the data accordingly. Now, when I click somewhere else and that collapses, I want to point out something very important. There's a very subtle two words saying multiple selections. It's not flashing in red and yellow neons. And please be very aware whenever you do select filters that you have a filter selected. It's not obvious at all stages, and you may come to say, well, wow, this data doesn't look right, there's something wrong with it, or you may not even realize that and start using it in analysis and then come to a problem later because you've got filters on. In this case, it's obvious total vaccines administered is nowhere near 7.8 million, But if we do something more subtle, for example, and select all, and then let's say for whatever arbitrary reason, I deselect Johannesburg Region A, you will see that the numbers dropped by a few 100,000. If I go here and start looking at these graphs and indicators, I may not realize that I've actually messed with the filters, applied filters to my data, and I might actually export and use this or cut and snip the graphs into a presentation, etc. So be aware whenever filters are selected that you are actually wanting them to be filtered in that appropriate manner. If you select all again and then click it now shows you all, it means that you're not filtered. So just be very conscious of whenever you're filtering. That district, province, and sub-district we've gone through. The next level in terms of location is if, for example, I select a particular location in my filters, the next level where I have facility and site information will now only show me options for Eastern Cape. You can see the EC prefix in front of all of these. So now my facilities and my sites will already be filtered based on my previous selection, but I now can choose to actually go and select only certain facilities and only certain sites. So I could start here and just start selecting, I want to look at this, that, and the other. And you'll see in a similar way, it's starting to filter your information. So it's just the next level after your district and sub-district. You can actually choose specific facilities and sites, and you can filter accordingly. Below that, we have a general selector for public or private, and that will pass your data, whether it's public facilities, private facilities. Just remember to put that back, take my own advice. You have by different self-reported medical aids as per the person's registering in the Evds system, which you can filter by. You can also choose whether the person self-reported that they had a medical aid or didn't have a medical aid at the time of registration. And then we come to another category where you can choose the actual vaccine type. It's fairly self-explanatory. If I, for example, choose Pfizer, you will see that my Johnson & Johnson indicators have gone blank, obviously, and my Pfizer values have remained where they were. Then the age filters, which I mentioned, we might want to be looking at only 60 pluses, or perhaps 50 pluses, in which case I'll hold down the control key and click on both of those categories, and I get the corresponding results in the different displays. Before we come to vaccination weeks and dates, etc., there is one very high-level distinction or filter that one can apply, and that's your vaccine rollout phase, either the national phase or the Sisonke phase, which obviously preceded it, which was the medical trials prior to the vaccinations being administered to the general public. So you do have the ability to look at one or the other, or both. Okay. In order to make data more manageable, since we have had this program running for quite some time yet, and there's been many days worth of vaccinations administered and many vaccinations administered, filtering your data by time, by date, is quite important, and we'll touch on why it is important a little bit later. But I want to show you 3 different methods of being able to actually select a date range, as opposed to seeing the program from the beginning to current. At the top right is a convenient year-month breakdown. So you can choose to say, okay, well, I'm not interested in everything. I only want to see 2022 data. Or you might want to say, I'm only interested in the first quarter or the last quarter or specific months within a particular year. So in this case, let's say I'm only interested in the second half of the year, July onward, in which case I've deselected the previous months and years. And here I have data reflecting July, August, and September only. So it's a convenient way, broken down by year and month on the top right, and is typically applicable on most pages, but perhaps not all pages. On the bottom left, as we alluded to earlier, you can choose your vaccination weeks. So if you are more epidemiologically inclined and want to refer to the vaccination weeks, you can select particular weeks in this drop-down bottom left, and it will filter accordingly. And a third method is to choose the specific start and end dates, which you can do in these two boxes. Here, I can click on that, I can click on that, I can choose 2022 and select 1st of August. And that will show me 1st of August on until yesterday's date, which is our last update date. So all of those three, the vaccination week, the start and end date, and the year and month, etc., are available to you to help you filter your data by date range. One of the reasons why we'd want to do that is because certain tables and certain certain tables have a fundamental limitation within Power BI, and they're restricted in terms of the amount of data that can actually be visualized. So I will show you shortly, when we hit that limit, how one of the methods of dealing with that limit is to restrict your date range typically, and allow you to look at it with a more narrow and less broad lens, and then you won't hit limits which unfortunately truncate and cut off values. So if I just go back and put this to where I believe it should have been, February 17, the start of the program to current, check all my filters are clear. I'm now back to scratch. I'm going to show you next two different functions to help navigate within the actual page, the information page itself. When you have a particular graph, maybe this is not the best example, but I think it will be an adequate example. Any particular graph or table that you wish to zoom in on and focus on, you can click on it or mouse over it, and you will see on the top right there are a series of buttons that pop up. One of them, this sort of rectangle within a rectangle and a small little arrow, is called focus mode. And when you click on focus mode, it's going to basically make that entire graph, or if it was a table, the full screen. It's taking up all of the real estate. It's now allowing you to see in more detail what's going on with that particular indicator. You can go back to the report through this top left button. I can go to this, for example, I can go to focus mode, click on it, and it will zoom in on that particular element of the dashboard. The next thing we have in terms of buttons is we have the ability to drill down or drill up in the hierarchy. So here I've just got my provinces, but what if I want to look at a lower level? So I can drill all the way down and start going, in this case, to district. I can look here, and now we've got our district levels. So we can see our 52 districts in the country, our metros and our other districts according to the way they've been divided in the data. I've been able to zoom down the hierarchy, and I can also click up, drill up, back to a higher level. So these buttons, the down, up, and double down, and I'm not sure what to call this, I suppose forked down. This allows you to drill up and down through the hierarchies. If on another chart or table we had a hierarchy lower than district, it'd also be able to drill us down to sub-district, etc. We'll see that maybe in a subsequent example. But basically, I can drill down on my data. I can collapse and expand, in effect, the detail, the hierarchical detail of what I'm seeing in this particular chart. So I'm going to go back to report. We're going to go to a page where we have, for example, tables. Okay, here we go. So here you have, for example, a table as opposed to a chart. And I can mouse over this, click on it. I can go into focus mode. By the way, when you're in a table, you also have the ability to just dynamically change your column widths. If you, just similar to Excel, if you want to start expanding, reformatting a little bit the information that's here. At this point, maybe this is the most important one to expand. There we go. At this point, we've got province, district, sub-district. Now I'm going to show you, you can collapse everything up. We can go back up to district, and we can go back up again to just province. Or we can collapse everything down one level to district and sub-district, etc. If you click on the double arrows, it takes you down to its lowest level. But you can also collapse and expand your tables with the small plus or minus buttons that will appear to the left of a particular row. In this case, I've expanded my Eastern Cape province into my districts, and I might want to then expand my Alfred Nzo district into sub-districts. So you can see it's a hierarchy. I can go further in this particular case to actually get my facilities. And within my facilities, I also even can go down to get the UUID, the unique identifier for that particular facility. In some cases, you will have it at a facility level, and below facility will be your actual vaccine sites. So these are the hierarchies and how you can collapse or expand a particular hierarchy to navigate through a table or graphs. On a page like this, there's also not just the disclaimer page in the beginning of the dashboard, there's also very useful information, which is sometimes at the bottom of the pages. In this case, they're footnotes to some of the indicators that you see here at the top. It may seem obvious, first dose, second dose, booster dose, etc., but sometimes these notes are extremely useful. Please read them. They do give you some nuances and some information that would help you to understand what information you're actually seeing. On pages where there's population data, for example, it could enumerate what the source of data is, etc. Okay, the next thing to know when looking at your different charts and tables is, in effect, the limitation that I just mentioned earlier, where, let's just collapse this up, where we have a daily view or table with daily information about first dose, second dose, booster doses, etc. So this here is, for example, for the 17th of May. But if we were to scroll all the way to the right and go through the days, we're going to see that we don't end up at the current date. We end up somewhere around May of last year. This is because the limitation in Power BI is unfortunately that it cannot display all of this information. It's too much data to display in a Power BI table. How will you know that there's a limitation being imposed? Apart from the fact that you've scrolled across and you've hit an obvious limitation and you don't have your totals at the end, there's a very small and subtle indicator. And it's an important one because if you end up exporting or using this information and you're not aware that it's limited, it could lead to, faulty analysis. The subtle indicator is there. It's a small lowercase I. And when you mouse over it, it says too many values, not showing all data. And really what it means is too much information to display in this particular table. There are ways to avoid this limitation, and one of them I've already mentioned is to filter your date ranges. So if I, for example, was to choose only to display August of 2022, you will see there's no longer a limitation. And in addition, if I scroll all the way across to the right, I can now see totals for all of those rows. And those totals should add up correctly and match with the indicators that are on the top of this particular page. There are other ways to obviously remove that limitation. You might choose to look at different age bands, etc., or different regions separately. A third way to avoid the limitation is that we acknowledge the limitation in Microsoft Power BI, not in our programming. And we've tried to work around it by building views which are not just, for example, daily views. So we have, for example, built the similar information, but here we've broken it down into vaccination weeks. So now it's not that you see number of doses, etc. per day, but rather per vaccination week 1, 2, 3, etc. And this is one way of circumventing the problem. You don't have a limitation. You've got all of your information, but obviously it's aggregated to week. There are numerous pages elsewhere where we've done, for example, a week view and even a month view to help aggregate the data up so that you don't have to segment it in order to overcome this limitation. I'm going to take my checkpoint now before we move on to a next topic, which is data exports. So let's see if there are any comments in the chat or any questions around what we've covered so far, which is the use of filters, the cautions around filtering, how to actually navigate within a page, to zoom in on a particular chart or table, how to collapse and expand the hierarchy of what you see, and then how to notice that you may have a limitation and how to potentially avoid limitations in certain tables. Becky, are there any questions?
Okay. Yes. At the moment, there are no comments, and there are also no hands. It looks like we're sailing very smoothly today.
Great, thank you for that. Okay, so the next topic is to say, well, okay, this is great. I can see a lot of information, but I wish to export information and I wish to use it elsewhere. In my own analysis, in a further analysis, in a report, etc. Whatever the motive, we have the ability to export a lot of this data. One of the ways you can export data on almost any graph or table is through the 3 ellipses or the 3 dots, normally referring to more options on any particular chart or graph. And so I select my particular table. I go to my 3 dots. I click on it. It gives me some options, one of which is export data. I click on that and I'm presented with a few more options, but it's quite simple actually. Suggestion is to use summarized data. I'll explain very briefly the difference. Data with current layout typically gives you more of the layout of what you see is what you get, but in a raw data format in rows and columns. The summarized data tends to keep more the hierarchy that underlies the information. And so if you're going to start wanting to take this data and pop it into a pivot table and do some analysis, etc., the recommendation is use summarized data. But play yourselves, play around, try with both, compare the 2 files. You'll see what works for you and what doesn't. An important point to note on data exports, it's one of the other limitations that are imposed upon us by Microsoft Power BI, is that it can only export 150,000 records if you are exporting to Excel. If you export to a CSV, it's even less. There's an even greater limit. But assuming you're exporting to Excel, it's only going to take 150,000 rows or records. It may give you a very small cautionary note in the top, in the beginning of your exported file, but it is certainly not going to ring any alarm bells for you. So please be very aware of this so that you don't export the data, proceed with a detailed analysis, present it to your management only to realize that there's a lot of data missing. There are ways to work around this. You can use filters to segment the data and then export it into multiple files. And then you are at liberty to combine it in Excel afterwards. Unfortunately, Microsoft, we've reported the challenge to them. It's known, but I suppose until they have a few other thousand users who are also complaining, they may not choose to prioritize fixing this at the moment. Just bear in mind a comparison between the limitation that I mentioned in tables, where there was that small I symbol. That's really restricting the number of columns that it's showing you. This is similar but different in that it's actually restricting the number of records that it can export. If you then hit export, it will basically give you a pop-up window. Where do you want to save the file? You'll save it and you'll have an export file available to you. At the top of the file, as I say, if it did hit the limit, it possibly will mention that. It'll also mention if there are any filters on. Please be cautious. If you have a filter applied, when you go to your export, it will filter the data and you will have filtered data in your export. So be cognizant of it, just like you would be when you view the data. Be cognizant of what filters are applicable when you export the data. In addition to exporting any particular table, we've also constructed a section in the menu where we've taken the most common, frequently used views and created tables that have that information available to export. Typical example would be as follows. Excuse me, a table which seemingly contains similar data, but now, as you can see from the different column headers, you've got your actual province, district, sub-district, facility, facility ID, site name, and then the month, because we're in a month view table, and then different parameters like uninsured, insured, your age category, male, female, vaccine type, and then all of your dosage information. So if you want to do analysis, you can come to this table. You can then go to the 3 dots. You can say export data, and you can proceed to get what's in effect in this table exported to Excel. It is exactly the same as the previous example I showed you, but once again, these tables have been constructed to try and lay the data out so that you're getting as much information into your export as possible. There are various pages. There are pages that give you your daily, weekly, and monthly views. Then there's cumulative. There are information relating to, for example, Sisonke booster doses, general booster doses, which is separate from those other pages, population information, just export of your population for your at a sub-district level, province, district, sub-district, etc. You can see here something I alluded to earlier, the age breakdowns. In this particular table are by age cohort, registration age cohort, whereas in other tables they weren't. They were in 10-year age bands. So when you come to your age filter on a page like this, you will obviously be able to filter according to age cohort and not according to the 10-year age bands. We've tried to also set up a section, a registration age cohorts, where you have various different data sets, but in this case specifically focused around making sure that the breakdown with respect to age is by age cohort. So arbitrarily, to pick on something like this, you now have something where there's individuals vaccinated per day, not dissimilar to what we've seen before. So there's a big caution, too many values, so we bear that in mind. There's a hierarchy we can drill up, just make it easier to digest for this demo. But the important thing here is to note that you can now filter, for example, on age cohort, and in this case, your 12 to 17-year-olds, etc. Right. Having either run out of steam or covered all the material, hopefully the latter, may I pause and ask Pietro and Mbeki, is there anything significant that you can immediately mention that I haven't covered that I still need to cover? And then Mbeki, back to you to see if there's any specific questions that anyone would like to delve into.
I think that you've covered anything that I could think about. Well done. Thanks, Anthony. You're good at presenting. Thank you.
Thank you, Anthony. I think you've covered everything very well. I think at this point we can ask again from our participants. Do you have any question, colleagues, or comments? Because we don't see any hands and nothing on the chat. We'll just offer this opportunity once again. Before I proceed to, I don't know, Anthony, I suppose it means you've done with the I can proceed to do the next section, right?
Yeah, I think so. I'll
Okay.
just mull over whether it's a compliment or a criticism when there's no questions, but we'll leave that to the imagination. Thanks. I am done, and I can hand back to you, Mbeki. Thank you very much.
No, I think some of our participants are coming in for the second time, I suppose. They were just. I would like to believe that they were here to just get clarity on a few things, which I suppose they managed to get, and then we can all proceed. I think the last part, which I'm going to go to now, colleagues, I think I have 9 participants. I think I need to remind people. I have 9 people registered right now. We had close to 30. If we subtract organizers, we had about 25 participants. I don't know why people are afraid to register so that we have a record, but please register. So I'm going to go to the last part, right? which is to talk about the user support package. Let me try to share my screen.
Becky, apologies. If I can just quickly also add to this, your request for colleagues to register, please note that the provinces are requiring from us the list of participants that are attending the training. In the recording, we can see the names of individuals, but they want a copy of the lists where users are actually registering themselves. So please assist us by making sure that we can provide feedback to the province in the appropriate way. Thank you.
Okay, thank you. Thank you for that, Petra. So let me put this one on slideshow. Right, so user support package segment is about where do we find more materials about this particular training. So at the moment, if you go to this website here, it's called hissupport.health.gov.za. So if you follow this web link, or if you type it in your browser, it will take you to a space where you will find the different training materials, and you have to specifically go to the information center training. So you will find this presentation that we shared here today. You will also find a tip sheet, which is this one. It gives us a brief overview of the information center and the processes that must be followed as an authorized user. And then we also have the quick reference guides, which is a screenshot of the different steps that you go through as you do some of the things that Anthony was taking us through. So it's quite also helpful for you to access that and to use it for your own understanding and in improving your confidence working around the system. Once we decide on which video to upload, I think at some point we will make sure that we have training video clips as well as the FAQs as soon as they are approved, and then it means there will be more material on the for people to use and to access. I think if you're having any challenges and you want to report maybe a specific problem that you might have experienced, you at this point, the way you contact support is you send an email to datascience@health.gov, and the subject line has to be information center, so that when that particular email request is sent, it's sort of goes right straight to people that can actually process it much faster. And I think it's important to remember this one. And this is the last part where we can also address questions if there are any, or comments before we say this particular presentation has come to an end. Are there any questions, colleagues?